us today. Good afternoon or good morning, depending on where you are joining us today. Please note that this meeting is being recorded, and if you do not consent to being recorded, you may please drop off the meeting at this time. Thank you. Okay, my name is Chairman Timothy Davis of the Blackfeet Nation from Browning, Montana. I'm a board member for the National Health Board and the Billings Area Representative. It is my distinct pleasure and honor today to welcome you to the fourth webinar of the National Health Board Association of American Physicians Act of Love COVID-19 Vaccine Webinar Series. Today's webinar will focus on the potential impact of medical vaccine trauma on vaccine hesitancy. Before we begin our important meeting, I'd just like to offer a prayer today. Ask the Creator to give us guidance and protection, and that we pray for those who have died from this COVID, all those who are sick or in the hospital. We pray for those who have been abandoned, abused, neglected, unwanted, and unloved. We ask for special blessings upon our veterans and those who continue to serve. We pray in gratitude for all those healthcare workers who have been on the front lines, all the other essential workers, and those who have provided the service to all of us as we experience this pandemic over the past 2 years. We ask our Creator to guide us through these difficult times. We ask this in His holy name. Amen. Well, as mentioned, as chairman of the Blackfeet Nation in Browning, Montana, what we would like to point out today is that while vaccination against COVID-19 is the strongest tool we have to fight the COVID-19 pandemic, people may still feel a bit hesitant about getting a COVID-19 vaccine because of past experiences and trauma. Vaccines play a crucial role in protecting tribal youth and tribal communities. So it's important to recognize potential barriers to getting vaccinated. Today's webinar will focus on the potential impact of medical and vaccine trauma on vaccine hesitancy. We'd like to thank all of our speakers for joining us today, and thank you for your leadership during this pandemic. Our discussion today is very important. The information shared will be used to continue COVID-19 response efforts for tribes and Native families. We will start this webinar with brief updates and remarks from our speakers, and from there we will move into our question and discussion session. At this time, I'd like to welcome and turn this over to Dr. Jill Jim from the Great Navajo Nation.
Thank you, Chairman Davis. I'm Dr. Jill Jim. I am the Executive Director for the Navajo Department of Health. I have a doctoral degree in public health and currently responding to the public health emergency operating against the Health Command Operations Center. So I look forward to today's conversation. Back to you, Chairman.
Yeah, so what we would like to do today is provide information on the hesitancy of receiving the COVID-19 vaccinations based on historical trauma. I recall growing up here on the Blackfeet as a youngster back in the 60s, how we would just line up in school and the public health nurse would come and inject us with the shot, and that we were getting vaccinated for like polio, smallpox, MMRI, and so forth. And so there are some people who are afraid of needles. I understand that, and as well as the discussion around the medical efficacy of the medicine, and also if there was any type of ill effects going down the road. So there was also some religious requests for exemptions. But then again, what we need to really understand is the effectiveness of this vaccine and how it has helped those who have been vaccinated to remain from being hospitalized. Although there have been breakthrough cases where people who are doubly vaccinated did receive hospitalization, but medical evidence out there is that most of those people have recovered, or they were not as ill from the effects of the Omicron or the Delta. So what we'd like to do today then, from Dr. Jill's perspective, we just provide the overview, updates, and how this medical vaccine has helped our people and all people to fight this deadly virus. Dr. Jim, so with that, I guess we could just let you lead us into the discussion on the efficacy, hesitancy, and so forth.
Well, thank you, Chairman Davis, and I'll speak to my knowledge from the Navajo Nation so far and during the pandemic, during this current pandemic. And I think that in regards to vaccines, I know there is some information I think we could glean on from the clinical perspective. I'll speak from the public health perspective on just vaccines and immunizations. And a lot of the vaccine, I think, uptake that we were starting to hear about during the pandemic was really some of the terminology that we're using today, like vaccine hesitancy, vaccine uptake, and then sometimes it isn't really hesitancy that we were dealing with, or it could be, or it couldn't be. So there was always this sort of unclear terminology that we created, but I think we're getting better at understanding vaccines. And I know for the Navajo Nation and for American Indian populations, one thing that we ought to think about is just the longstanding development of public health service in Indian country, and that started after the 1950s, and then working towards establishing public health nurses and clinical services to tribal nations across the United States, including on tribal land and also off tribal land in metro areas or urban areas. So we have a wide spectrum of how vaccines have contributed and benefiting our population. I know on Navajo Nation, we have our own human research review board, and we work with several universities that have done studies to address and introduce new vaccines for the general population as well. So however long sort of these vaccine studies have existed in tribal nations, I think could contribute to some of how our behaviors or thoughts about vaccines are. And if there has been limited introduction, or if there has been mistrust, I know there are several tribal nations that might have dealt with researchers coming in, and their samples of their specimens they provided for research might have been misused or utilized for other purposes without their consent. And I think that has caused a lot of concern among tribal nations and members. And there always is sort of that ongoing protective factor that tribal leaders try to address with external people coming onto the Navajo Nation, or either onto tribal land, or even within urban areas, and making sure that people are well informed about just what research is being done, and how their information is utilized, and how it protects people, and how it benefits people in return as well. And so there's a process that everyone has, every researcher is quite aware of, and that's why institutional review boards are very important. So so that's sort of that perspective. Just the environment around vaccine uptake, I think, has some presence here and within Indian Health Service and universities doing research, and depending on which tribes, and it varies too, as I understand. And I think that the efficacy of vaccines, I think one thing to think about is when vaccines were introduced, there was a lot of concern, I think, just within this pandemic, about how quickly the vaccines were approved and processed. But there has to be reassurance and trying to rely on clinical and scientists that were working on this. And a lot of that we had to vet very carefully. And I know several tribes participated in some of these vaccines that are now available, such as Moderna or AstraZeneca or either Pfizer and some J&J, but I know that for the Navajo Nation, as we were going through this process, we acknowledged and participated and through the IRB approving a study for the Navajo Nation as a phase 3 study. And that means phase 3 study, meaning that the other individuals were already part of the study in phases 1 and 2. And there wasn't a lot of concern for it. And so when you're at phase 3, it's close to implementation of the vaccine to the general population. And so there was sort of that assurance on our end that although we were barely participating in the study in phase 3, we also acknowledged that that there wasn't issues that we were going to experience, and there was some sort of benefit that the vaccine was defending against the coronavirus virus. And so I think there's just that the research aspect, the process that they go through, and the efficacy isn't entirely 100%, but it is enough. And so I think when people look at vaccine, and if there are unvaccinated individuals that are still deciding, I think a lot might have to do with either personal preference or either just misinformation in general. So in this pandemic, I think we dealt with a lot of just battling that, trying to clear way because there has every single person is up against misinformation every single day through social media and information that we're being provided. And I think in Indian country, it's quite different. We have broadband connectivity issues in most areas on tribal reservations, and sometimes providing information through the radio. And also, even though we had shelters in place or lockdowns, information was given through town halls and Facebook, and also bringing Dr. Fauci on to the at one of the town halls for the Navajo Nation, and tribal leaders just believing in science and also supporting the vaccine contribution and efficacy. And I think that helped out a lot. And so it does take a lot of people and a lot of just consistency on how we can get people to get their vaccine. And along with all of that, I think a lot of things in this pandemic, when we look at vaccine uptake and how we monitor and manage that, we have a lot of lessons learned. And that means, well, who isn't getting vaccinated and why aren't they getting vaccinated? And so building public health messaging around those sort of information has also been an ongoing challenge, because now you have expanded age groups that are now eligible for vaccine uptake, and we're trying to get each group vaccinated, fully vaccinated, and even now the definitions of getting a booster shot and booster vaccine surveillance is definitely something that's really, it could be challenging for tribal nations if they don't have the capacity to monitor and aggregate real-time and daily vaccine administered that were administered that day. So I hope that kind of gives it an idea about the efficacy. We know that it has withstood the Delta variant. We also know that with other variants as well, we also know it's effective against Omicron as well to some extent, but there are breakthrough cases. We know people are still getting sick as well, but even though you are getting sick, you have a mild illness and you're preventing severe illness and hospitalization that requires an inpatient stay, or even basically avoiding and preventing death as well. So I think that we don't know what new variant will come our way. We can't tell the future, but we know that vaccines are probably the only sort of solution right now for people that haven't get vaccinated to basically stay healthy. So I hope that answers some of your questions, Chairman Davis.
Chairman Davis, if you are talking, you are on mute and we can't hear you.
Okay, I hope I hope I'm okay. Here, Dr. Jim, thank you so much for the explanations on the great studies that were being conducted out there, and that hesitancy created by the former historical studies that were conducted on reservations as well as urban Indians. So we understand that there was some hesitancy, but again, as you stated so eloquently, the people that were vaccinated, it did help a lot of them from receiving hospital care, and they might have had symptoms but mild, and some still did get sick. So I know we are at this time for question and answers with Ms. Darby Galligher. She'll kind of direct those questions. People can raise their hand, chat box. How, Ms. Gallagher, would you like to proceed with the questions you had for the historical traumatic experiences that may influence someone's decision to get vaccinated? You were going to go ahead and just ask those questions and put them in the chat box. Is that how we're going from here, Ms. Gallagher?
Yeah, so I can actually go ahead and ask this first one if you'd like. Dr. Jim, these will be for you. And then those of you who are watching, if you do have any questions, feel free to type them in the Q&A box, or you can raise your hand and I will try to unmute you. So Dr. Jim, the first question is, how can historical traumatic experiences influence someone's decision to get vaccinated? Or have you seen it impacting the decisions of others?
Thank you for that question, Darby. And in regards to in historical trauma, I think that has been a field in itself, an evolution of it in itself for a number of years across tribal communities. And I think with historical trauma influencing someone's decision to get vaccinated, really depends on the experience for each tribal nation, I believe. Each tribal nation has its own experience on how they define historical trauma and how that could relate to generations of generation to generation. And sometimes that might just require sort of that understanding. But for me, I think there is probably subtle evidence that that could relate to historical trauma, and it could relate to not only it could come from the perspective, I guess, of how tribal nations might have perceived or dealt with government. It could be other ways of just understanding. I know with the Navajo Nation, we've experienced the long walk, which was our ancestors went from the Navajo Nation in Arizona to New Mexico, and some families did not experience that and some families did. And then historical trauma can be redefined in numerous ways over time, something that could be an event that has happened a long time ago, and it could be our current societal issues. So I think in numerous ways there has been sort of that impact, because this pandemic has just uprooted all our livelihood. But I don't know, it impacted the way we lived every single day. And I think that some of the symptoms of historical trauma could also could have been exacerbated even more during this pandemic. And even if a person wasn't experiencing historical trauma, they probably were experiencing some sort of trauma as an individual, a family, and I think as a population. But now what we're dealing with is the entire mental well-being and personal well-being of our entire country across the United States. This is something that we were never thinking that we were going to encounter, but the pre-existing issues before COVID existed before, and then we were already dealing with helping our people and building resiliency and maintaining it. And even younger individuals that are here in also from different generations, and also dealing with elders, and what it did to us as tribal nations, I think will require a lot of rehabilitation and just and finding a new avenue on how we can overcome this. And that really comes from our cultural teachings and values. I think that's what's going to resolve a lot of this. I know we're in each tribal nation, our way of, and in the Navajo way, we always say Navajo way of life. What is our way of life to build self-esteem and as individuals, and also as encouraging individuals to empower themselves, not only for themselves or other individuals. So I know that during this pandemic, it probably did glean on and also has similar symptoms of trauma and depression and low self-esteem and not knowing what the future is. And a lot of our people, even myself, like we don't know what is in front of us, and it still is something that we deal with. And it isn't just the everyday person is impacted, but also professionals and frontline workers that have been dealing with this the entire pandemic. So there's a lot, I think, that would need to happen. I don't know if the term post-COVID really will exist. We were beginning to introduce terminology saying post-COVID, but at the same time, will there really be a post-COVID, and will COVID-19 always exist and we learn how to deal with it and we coexist with COVID? And what does that mean? What does that mean, and how do we transition? Because we have certainly been up through our up and downs, and I know the surges and nationally could quite be different in tribal nations, and some might be experiencing high cases right now and low at different time periods that the United States is experiencing different trends. And so I believe we have our own bubbles in tribal nations and we respond differently at times, but there's a lot to do that we still need to learn from. So I hope that answers some of the questions, Darby.
Yeah, thank you so much for that, Dr. Jim. I think you worded that really well. I really related with that not knowing aspect. I feel like a lot of questions, someone will ask me something, I'm like, I don't know yet. We can move on to our next question, which is, what are some ways we can overcome our trauma and that sense of not knowing, and ensure that we protect ourselves and our community from COVID-19?
And thank you for that question. And I can speak to what I mentioned earlier. And I really believe in not only, I mean, we have different beliefs in our tribal nations. And I think that some will have to do with a lot of those beliefs, if they're cultural or adopted from other tribes or other faith-based organizations, perspectives and beliefs. I think all have to sort of be part of our individuality and finding a way to live with COVID and coexist, as I mentioned, and a lot of that discipline. And if you really think about COVID, I always think about it from the public health perspective and from a medical perspective. I think when you think about COVID in general, it is a respiratory disease, and you want to make sure that first you don't get sick. And there's different ways of thinking about a respiratory disease or a flu or something that you don't want to get. The first stage is trying to prevent getting sick. And so that means, and in Navajo, we call it the Kosinsaginas Ada. It means it's similar to the flu. And that's how we could describe it, is similar to flu and symptoms is how we envisioned it at the beginning, not having a name for it in Navajo. And that's just a common name that we adopted. And so when you think about health behaviors or anything that you want to prevent, and this can be related to diabetes, heart disease, those are all preventable diseases that we talk about outside COVID. And it's the same sort of steps that people need to follow, and how do we prevent COVID. And I think if you don't have COVID yet, how do you prevent COVID? That means we have the 3 W's: wear your mask, social distance, but I usually like to prefer calling it physical distancing. And we have certain feet, 6 feet, 3 feet, and that we recommend, and masking. And the masking part, I think there's we often receive guidance on what kind of mask to wear, but sometimes those are not reasonable in Indian country. We don't have N95s at our fingertips. We don't have KN95s at our fingertips. And how do we do that? I mean, if we just have a fabric and a regular surgical mask that we can get, we can use a double mask to prevent COVID. And I think just being cognizant of all the things that we learned throughout the pandemic, they have not changed. It has not wavered. And so we we listen to those recommendations and make adjustments along the way. And so I think those are things that we can certainly think about as our individual. And the thing I like about being Navajo and being here at home is that we always have a sense of belonging. We have a sense of belonging to our communities and to our families. And our elders have taught so much to us, either on our father's side or our mother's side, about just having that integrity and representation of your family, and that you have to do good, not only as a citizen, but also as a family member, and you're representing your clan. So I hope that this has reinvigorated individuals to really think about how we have and can do really well, and we have across Indian country with vaccine uptake, really just smashing other states, or even sometimes internally within our states, that we do better. And I think that's something that we have to be proud of. And so I think reminding individuals that we, as a population, have done really well. And so that goes back from the individual. And so you have to continue that. I think there has to be a lot of positive reinforcement, and that you give to kids that are in school now. And kids are now in school, and asking them and reminding them to wear their mask. And certainly we have, I have kids, and just reminding them, like, wear your mask. And they're like, I know, Mom, like that kind of attitude. But it's always good to even just remind them and see if they're wearing their mask. And sometimes kids can also remind adults to wear their mask around others. And I think there's a long ways that we have to go, though. I know here and sometimes as public health professionals, we really look at cultural or population sort of behaviors that might contribute to increases. I know this isn't like sort of evidence, but in some groups, for certain studies, they look at just that gatherings. We love that first laugh gathering, the puberty ceremonies for women, or either men, or certain milestones in people's lives. There's always a gathering and a celebration. And I think that was the hardest thing for a lot of our families, and the prayers they needed to get done, not only for winter to be okay, to give moisture to Mother Earth, for summer to come, and to prepare the soil for vegetation, for planting corn, and then for celebrating harvesting and the New Year's within our own tribal communities. I think has really been something that really has impacted us, not having that. And I think that going back to just how could we tried to stop, but public health emergency orders were very difficult to do that. And so I think there's that part of aspect of the pandemic, is that there's some celebrations, some sort of activities that we couldn't just uproot them, but we did. But that's probably something we have to work towards, and trying to do it safely. How do we coexist with safely doing those activities, so that we are mentally healthy, and we also have the ability to just reconnect with ourselves and the nature and everything else. So I think that gatherings is just something that was very difficult, but I think we can overcome it going forward. And then and thinking about prevention, so just who we are as Native people, I think those are just some things that I have observed and trying to understand how do we address this going forward. And right now, I'm Indian country. Everyone knows that basketball is a very highly attended activity, family activity, or community activity, and people will move hours and hours of driving just to attend these activities. And it's a tradition, it's a culture, it's an activity that we know, and we're very proud of it. And right now we're with the very high Omicron cases here on the Navajo Nation, we're limiting that participation just because of how transmittable it is. And so people are adjusting to understanding what transmittability really does mean, and to the extent of how contagious Omicron is, and we're seeing it. Um, and going forward, I think people just need to recognize, like, how do we address that and the activities that we live with. And so I think those are just some examples that I see here that we're experiencing, and I'm sure that it's happening elsewhere. And how do we coexist? And another level is if someone is sick, and what do we do? How do we protect ourselves? And I think when someone does get COVID or Omicron, one thing there's just a lot of misinformation about the virus itself, saying, well, I'm protected, so I don't need to wear my mask. I don't need to get a vaccine. It's okay. I already got COVID. And I think the purpose of trying to message what is out there is that yes, you might have had COVID, or you a while back ago, and you still need a vaccine, but you're still highly contagious. It's to protect other people from getting sick, especially our elders or other kids that we might feel like they have immunocompromised systems as well. So there's a lot of education that could be redone for those individuals. And sometimes we talk about that in the town halls, letting people know, like, well, if those are younger individuals, who has these perspectives that they're okay and they don't need a vaccine, they don't need a mask, but they can gather. And we know that it can transmit very easily. So I think there's ways of educating individuals that are recovering or have had COVID, and letting them know that after 3 months you can still get a vaccine, you can be further protected. Yes, you're protected right now, but you can be further protected more. And then the purpose of you limiting your travel and going somewhere is to not infect other people. It's the safety of other individuals that we also are concerned about, so they don't get infected. And then for people that are recovering and the isolation and quarantine, like following the guidelines that were recommended by the Centers for Disease Control and Prevention. How does that work for tribal nations? How have we adopted those? Are those doable for us? I know it has caused a lot of confusion, but we're adjusting to it here on Navajo Nation. And one of that is just reminding individuals what those are and how to safely isolate and quarantine and be prepared for it. I think several times we're not prepared for it, but and giving tools to individuals, like how do you prepare to go to the hospital? What do you need to pack? Extra clothes, a book, or if tribes have isolation hotels, what do you ask them to have? A bag of clothes. If you know that you might be the only care provider, how do you prepare if you accidentally get sick? Do you need someone to take care of your kids? You need to have someone take care of your animals. Who needs to do errands for you and make sure you're feeding yourself? And those are just things I think that we're going to continue to deal with, is that at home, how do we safely have people isolate or quarantine and in homes, and then making sure people go to the hospital when they need to. And now we have COVID-19 testing, home test kits that for a lot of our elders, there's always a question, well, how do we use these kits? And so we have some facilities translating those on how to get home, instruct themselves on how to test themselves. And there's also not only the question about the vaccine, but people are also hesitant to use the COVID-19 home test kit and also asking the same questions about accuracy. And it's not completely accurate in some of these home test kits. They are federally, they are FDA approved, or and they can still use it. It can still be useful to some extent if you have access to it. So I think in this pandemic, those are just some experiences, and thinking about at what stage you're at as an individual. Either you're preventing COVID or you have COVID, and how do you not spread it? And if you have COVID and are in the hospital, we just want to make sure that you get the care in a timely manner. Another thing with the Delta variant and the Omicron, that whole variant just changed the game plan of treatment. And so now that Omicron is variant, some treatments are not effective. And I hope that we get access to treatment so that communities, if they have a home test kit, they can immediately get tested and then get treatment within the certain amount of time. So there's always a timing factor, especially with this, so people can benefit and experience less illness and not have severe symptoms as well. So I think those are just some ways to protect ourselves and our community from COVID, is just beginning to see what am I doing every single day. And I'm masking up, and here on Navajo, there is still an indoor and outdoor mask mandate across the Navajo Nation. And one thing that we encourage the Navajo people to do is not to feel like they're ashamed from wearing a mask. There's no shame in wearing your mask outside the Navajo Nation in communities that are not, that don't have a mask mandate, and be proud of it. And so we have to encourage individuals for their behaviors of how we know that wearing a mask is also can protect individuals as well. So I hope that kind of gives some insight on what individuals and communities can do and how to perceive next steps or in coexisting with COVID. So back to you, Darby.
Yes, thank you so much, Dr. Jim. That was a great answer. I liked hearing you talk about all of that. I only have one more question for you. So for anyone else in the audience, if you do have any questions for Dr. Jim, again, just a reminder, feel free to type them into the Q&A box or the chat box, or you can raise your hand and then I can unmute you. And Dr. Jim, I know you touched on this a bit with the last question. They're kind of similar. But how can tribal healthcare providers and public health professionals better address trauma in communities, and then subsequently from that kind of try to increase COVID-19 vaccinations?
Yeah, this is definitely something that I think is going to require a lot of attention from public health professionals, or I would say mental health professionals and tribal leaders and healthcare providers. Some tribal communities might have contracted or compacted health facilities, and some might have federal facilities. So a lot of collaboration between tribal leaders and healthcare systems ought to happen. And I certainly think, as I mentioned at the beginning of this conversation, is that we did experience some sort of trauma as a population. The amount of deaths that we experience here is very something we never wanted to experience, but we're here. And I think it's going to take a lot, because how we normally receive services like mental health services and counseling services are not the same right now, until we figure out how to increase and expand services through safely doing it and making sure we have resources available. And sometimes it could be difficult. I think that there has to be a buy-in, and also a voice from tribal leaders to support healthcare facilities to encourage sort of that next step on how do we deal with this. Like I indicated, that I think with sort of this trauma on what we have experienced will vary across and how it's defined. And we still don't know yet because we're still in the middle of it. And so I don't know. I know for long years to come, possibly that we will see the result of that. But right now, I feel like we as a nation and tribal nations are just responding to make sure that we safely live our everyday lives. And how do we do that? But as far as trauma that has already experienced, I think coming together with tribal leaders and healthcare professionals and if needed, requesting for federal resources from FEMA. I know that the Navajo Nation has initiated a crisis counseling program, which is just breaking the barriers of something different and new and declaring COVID as a major disaster and getting resources that we are allowed to have as a tribal nation, that we should be reimbursed for the services that we're providing to our tribal people. And that requires just understanding how we can collaborate. It's going to require a whole village to heal us. And I think that's the road forward. But in the meantime, I think we're just trying to encourage people to safely live every day. But there will be a healing process that will have to happen, and that will require acknowledging the situation and figuring out how can you address this for every individual and community. And that will require just the healing process, however that will be defined. I think will be different for tribal nations. Back to you, Darby.
Thank you so much, Dr. Jim. I liked that answer too. I feel like I like all of your answers. I do not have any other questions. We can wait a couple minutes and see if anyone else has any questions. But if not, I can pass it off to Chairman Davis after this, and we can end a little bit early. Thank you so much.
Thank you, Darby, and thank you, Dr. Jim, for the great presentation there on the historical trauma and the need to continue to move forward in this unknown and uncertain times. You mentioned the cultural activities that we all have been accustomed to as tribal nations and the impact it has had these last 2 years and continues to go forward. But just reading about some of the other cultures out there, like the Irish culture, they will, for the first time, will have this spring their St. Patrick's Day parade, and they'll open up back up there after 2 years. They're going to go ahead and just go forward, like you're saying, and I guess, but they are continuing to say, wear your masks, do the safe distancing, sanitizing, and then vaccination is kind of the key, like you said. So it's hopeful that as we go forward, more and more people will receive the vaccination to protect themselves as well as others. And that, you mentioned, Dr. Jim, the mental health. I have a girl that teaches school, and she kind of shared with me some of the students how we'd go in person back to Zoom learning, and now we're just, because of this Omicron variant, there was some discussion here with our tribal government last week to discuss the possibility of doing maybe some ramp backs and trying to get ahead of this curve. But it sounds like it's out there, but the kids are kind of like, no, we don't want to go to Zoom learning. We'll wear our mask kind of thing. Let us stay in school kind of stuff. And like you said, the sports, that's the same thing here. It's been a historic opportunity for our people to really get out there and support the youth and that. But one question I had was from masks on the younger people, do you foresee any type of future requirements for more protection against asthma and so forth? Do you think that'll create any type of long-term effects on our little ones that have had to put these masks on all day through school and then go into the store or wherever they go to continue to wear their mask, and the impact there? So do you foresee anything there on that side?
Thanks, Chairman, for that question as well. Nothing at the moment. There isn't a lot of evidence, and I think if there were to be evidence, I know that either CDC or either the OSHA, NIOSH, or other individuals would have that sort of information. And I know that wearing masks could be a concern, and sometimes I think about this as other countries have worn masks all the time. It's part of their everyday life, and that was the Asian culture. Certain countries have that, and so I think about the acceptability, but I haven't heard of any evidence around that. I know that that has been brought up by parents or other to me from when they're asking about the mask mandate. And I think, I mean, if there is a medical concern that has an allergic reaction or other issues, I think certainly there is exceptions for that allow for people to not really wear a mask if there is any reactions to it or a concern for it. But right now, I don't have any general information on that, Chairman.
That's very good news. Thank you, Dr. Jim. Ms. Gallagher, was there any other questions that we had, or is this the time to go ahead and thank everybody that participated in this great presentation by Dr. Jim from the Navajo Department of Health?
We do have one more question, and this one is also for you, Dr. Jim. So this question asks, how are you outreaching to rural community members regarding vaccine advertisement and updated COVID news, specifically those who do not have access to everyday technology?
Yeah, that's a good question. Well, much of the Navajo Nation, I would say, is rural and remote. And before this pandemic, I never knew how remote we were and how hard it is to reach 1,000 elders to give them food. And it has changed my perspective on how we perceive geographically distance and whatnot here on tribal lands. And we drive through our lands every single day, but this has been a very interesting experience. And in regards to outreach to community members, like I indicated, we did a survey through our chapters are almost like cities. We have 110 communities across the Navajo Nation, and we did a survey early on asking about their preference on what radio stations or how would they like to receive messages. And so from that, we were able to identify certain radio stations that were more prominent in their area, and we did a radio tour. We might have done only 1 or 2 radio tours, I can't recall, and that means we went through most of those communities and provided messaging, and then we have ongoing messaging that's often provided through the radio, and that is, I would say, the more reasonable approach to getting elders and others that don't listen to that. But not everyone does listen to that, and that's the other interesting part. But everyone has a mobile phone, and they are really active on Facebook and town hall meetings. So we use a combined effort, and then also the newspapers. We provide information, or they provide information in the local newspapers about information we've ever given out, or either reporters that are using the information from the Department of Health on cases, or either just national information about the virus. And so there are multiple ways, but I know that doing a community survey, just a really informal survey, was just a good way to get information out by identifying what the best method would be. So I hope that answers it, Darby.
It did. We can see if there are any other questions. I don't see any other ones. We can give it just a couple more minutes. All right. If we do not have any other questions, Chairman Davis, we can turn it over to you to close us out.
Thank you, Darby. Could you put my video on so I can show what Dr. Jim was talking about as far as masking? If anybody can see it, I don't know. I just like to present the...
There should be a button in the corner down by the mute button that tells you, it looks like a little camera. You should be able to start your video.
You cannot start your video because the host has stopped it.
Interesting. Okay.
Well, I was just gonna tout the mask that the National Health Board sent out to people called Act of Love. It's a very nice mask. So I just want to thank the Health Board for sending out these masks to our constituents throughout the nation. And I know we have had come to our end now, and we'd just like to thank everyone for joining us today. And all you who have shared thoughts, questions, or comments, or concerns. A big thank you to Dr. Jim for this great presentation, and you Darby, for asking the questions. And so before I close, I would just like to offer a prayer that sums up our situation here, where we continue to ask our Creator to bless, guide, and protect us as we go forward in our life journey, and that we will work together to provide assistance and love and respect for all. And just say, glory be to the Father, and to the Son, and to the Holy Spirit, as it was in the beginning, is now, and will be forever. Amen. Hallelujah. Again, we'd just like to thank all of you for your time today. And if you do still feel the need to provide feedback or ask questions, you can email your questions to Darby Galligher at nihb.org. She'll be glad to get some research out there if your questions for Dr. Jill. Again, Dr. Jim, thank you so much for providing us great collaboration on the COVID-19 vaccination hesitancy and trauma around vaccines. We also invite you to attend any of our other NIHB website listening sessions that are up in the future. They post them out. And we just look forward to staying in contact with everyone, and wish everybody to be safe, happy, healthy, and holy at this time. Thank you again for being with us today.